Let's talk about high ankle sprains, or more technically, syndesmosis injuries. I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of the book, That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on all sorts of sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. A video a couple of weeks ago that I recorded on sort of your traditional ankle sprains, the lateral ankle sprains, we talked about the grades and the severity and how long it took to get better. And I mentioned there that with a high ankle sprain or a syndesmosis injury, that can make it take a lot longer. A high ankle sprain or syndesmosis injury involves a lateral ankle sprain, usually with a twisting injury, but it also involves the ligaments between the end of your shin bone, your tibia, and the end of your fibula, the bony prominence on the outside of your ankle. So there's an injury to the tissue a little higher up as well as down at your ankle. And that involves more force and, unfortunately, longer to get better. As we see you as orthopedic surgeons or other sports medicine physicians treating you, we're going to do the same exam that we would do normally. Examine your ankle, check where you're tender, potentially get x-rays to rule out a fracture. Probably not going to get an MRI because this is something typically we can diagnose by physical exam. But then we're going to do some things to try to get you better. Like we talked about with lateral ankle sprains, things like ice and things like maybe a brace or compression wrap. Physical therapy can be all very important, but a brace is probably more important here even than the lateral ankle sprains because the ligaments a little higher up that are injured, sometimes there's braces that are more effective at providing compression just above your ankle so it's more comfortable to walk. As I said before, and I've said on my website too, high ankle sprains typically take a lot longer to get better. Typically take about 6 weeks or sometimes 8 weeks. The challenge is a lot of people when they hurt their ankle, either they're told it's just a regular ankle sprain or they never go see a doctor and they think it's a regular ankle sprain. So then they're frustrated at 4 or 6 or 8 weeks wondering why they're not better, and it's largely because they didn't know that it was a high ankle sprain, that it's going to take longer in the first place. So getting the proper diagnosis on the front end is typically really important. Fortunately, this almost never needs surgery. There are some rare examples when it would. That's why I think going to see a doctor that does sports medicine and sports injuries is really important early on, even if you think it's just an ankle sprain, to find out exactly what it is and make sure it's not a more problematic issue. Okay, have you had a high ankle sprain and how did you suffer it? How did you find out what it was in terms of seeing a doctor, and how did you get better? In the comments below, please share your experience. Now, I can't answer the questions you leave there for legal reasons, but I'd love to hear your experience, and honestly, I think people all around the world would love to hear your experience as well. I'd also love to hear the #1 injury challenge you're facing with your injury. In the description box below this video, the very top link will take you to a page on my website where you can tell me all about your injury and the challenges that it gives you. That information is really helpful so that I can create videos and articles or even courses or programs to better help you. If you like videos like this and you want more information on sports and exercise, injuries, injury treatments, injury prevention, even access to my Ask Dr. Geyer live videos on YouTube, subscribe to my YouTube channel. Click the subscribe button in the upper right corner of the page and they'll get delivered directly to you. Thank you so much for watching. Really hope this video was helpful, and I look forward to seeing you right here next time.